While we're recognized for surgery, I think that my skincare providers and certainly my injectors are the best in the country. We're fortunate to have 11 skincare providers and injectors in the practice, and so I'm really happy to be surrounded today by my 3 directors who are absolutely great. I'd like to hear from them what they think has made them so good over the years.
Well, I think that we've had an incredible opportunity to train with the best and some of the best injectors in the world. I also think that what makes us really great is our time that we spend with patients and the assessment and the education that we give patients. We keep abreast of all of the latest and greatest technology, all of the new dermal fillers, and really make sure that we can offer those to our patients.
We've been doing this for 18 years or longer. We've learned from the best. We have an in-depth knowledge of plastic surgery. We have a lot of knowledge about dermatology, and we really understand the products and how they can work for someone, particularly where they fit in a specific person, population, where the syringe may end and surgery may begin.
We all have this tremendous sense of anatomy. We know everything from the inside out. We've taken cadaver courses. We've trained others. So when you get to a point, I think, of knowledge where we can not only educate our patients, but share with our peer group as well, it just escalates the entire field, and it escalates our practice because we get to bounce ideas off of one another.
That experience can't be replaced, but more than the injection, more than the technique, what I think I'm proud of is that you all have your own aesthetic, you reflect your own aesthetic, and you don't have me on your shoulder. You trust yourself. Tell me about training others. What have you learned from that?
Whether I'm training a new person who is like newly trying to learn how to even hold the syringe versus someone who is like us and has been injecting for several years, but they're trying to gain a few pearls, or there's something new out there or a new product. I absolutely love doing it, and I always learn something myself.
Could you imagine providing an injectable consult without having that background in talking to patients about their appearance and what they want?
I think that my background in a surgical consultation guides my injectable consultations now. I listen, I take photos, so we really assess facial anatomy, and it really helps me game plan the treatment plan for the patient, but more importantly, to educate the patient on why we're making the decisions that we're making from an injectable standpoint. And also, it helps me sometimes determine who is not a candidate for filler, and maybe a surgical intervention or a skincare intervention would be more beneficial. So I'm able to give patients a more well-rounded consultation with my surgical background.
Tell me when an injectable patient becomes a surgical patient.
So there is a time that comes when a patient is no longer satisfied maybe with their results from filler, or that I know that I cannot deliver the best result for them with what I have in my toolbox. And so I have excellent skincare providers, I have excellent injectors, and I have an excellent plastic surgeon. So when the patient does get to that time in life, it's a very natural conversation for me to say, hey, listen, your neck or your jawline, this might not be amendable to the things that I can do for you.
And patients are so grateful for the honesty, right? I mean, they love the fact that we have a next step for them in their plan, or a next referral for them. And so I always find it's met with gratitude and not resistance. Thank you for letting me know that.
Kimmy, you treat a lot of men. Tell me about the uniqueness of both neurotoxins or neuromodulators and fillers in men.
I think men in general are superb candidates for neuromodulators and fillers, particularly because of anatomical considerations. Their bone structure is, more significant. Their tissues are a little bit heavier, and therefore they don't tend to have as many laxity or skin or gravitational changes as abruptly as the women do at the same points in time along the continuum of aging. So if they come in and get revolumized with some fillers or some biostimulators and maintain a little bit of Botox, it's a really safe, simple, and effective process for them. Men are pretty simple creatures. Will it work? What will I look like? How much does it cost? Good, done, let's do it. Your body of work is just a bunch of words unless you can show patients a good result. And when a guy can see another guy that had a good result and he doesn't look weird or awkward or distorted, they're very enthused that fillers or Botox can be very suitable for them.
There are 6 other injectors in the practice. Tell me about the responsibility of teaching your colleagues and when you feel comfortable to say they're certified or they're credible or they're able to treat our patients.
I was really taken under the wing and taught, and I felt like I had such a mentorship here at Bucky Plastic Surgery, and so I still try and continue to provide that to the younger injectors with feedback, with demonstration, with observation, and I feel like it's a great working relationship. And I always allow myself the same way that you guys did for questions, concerns, feedback that was so valuable to my growth. And so I think we provide that to the younger injectors.
They shadow us, they spend a lot of time with us learning. We are very open for questions, we're very open for feedback. I think we're incredibly approachable. We just want them to be as good as us.
And the ability to have such bright minds and capable individuals who have all the right ingredients to care for patients. It comes from nursing, it comes from a desire to take care of people and then being excellent at what you do. And that's what makes us really, really good. So thank you all. Thanks for all that you do, and continue on.